But we begin tonight where we've spent much of the past 3 weeks inside Dunedin Hospital. Today, the external review of urology services at the hospital was released. Now, some of what we've covered in the past 3 weeks has had nothing to do with urology. Delays to heart surgery because of insufficient ICU beds, general surgeons only getting 2 operating days a month, and much more. But the review was into a urology department that was clearly under pressure and clearly making patients wait too long for treatment, even after cancer diagnosis. And that's what we'll look at tonight. We begin with this look back over our coverage of the past 3 weeks.
We've always felt the public system would be there in a time of need, and clearly in this situation, it's not.
Murray has elevated PSA levels. It can be a signal of several benign conditions, but it can also be an early indicator of prostate cancer. Understandably, the 67-year-old wants to know more. So he went to see his GP, and his GP referred him to a specialist at Dunedin Hospital.
The letter I received from the Southern DHB says this referral has been given a priority of urgent, with a capital U for some reason. The recommended average waiting time for referrals to the urology service is urgent within 3 weeks, semi-urgent within 6 weeks, routine within 4 months.
So Murray was urgent with a capital U, 3 weeks recommended waiting time, but he will wait much longer than that to see a specialist. And that's not for a biopsy or surgery. Those lists are separate.
Currently, the estimated wait time for your appointment is 12 weeks.
Murray contacted Checkpoint after listening to the Health Minister, Jonathan Coleman, speaking on our program on August 4th.
Obviously, urology in Dunedin is a problem. It's been described to me today as a toxic department. They've got to sort their act out there. They've got to provide the radical prostatectomies, the urgent testing that people like those, really good down-to-earth New Zealanders we've just heard from deserve and should get.
And Murray isn't the only person waiting and waiting. Paul Schofield was diagnosed with prostate cancer in February after paying for his own biopsy. So you've had a biopsy, you've been diagnosed with prostate cancer, you've been told by the hospital initially that there needs to be surgery and it needs to be done relatively expeditiously.
Yes.
It hasn't happened and you really haven't heard from anyone since?
No.
Are there other people that you know of in a similar position?
I understand there are, from, communications I've had, that yes, there's other people waiting for surgery too. Some of them have been waiting for some time.
How many do you know?
I was told 7.
Ewan Kirstens is waiting too. In December last year, his GP found Ewan had elevated PSA levels and an enlarged prostate.
I wasn't even seen in the hospital just for the initial cursory examination until March, and at that point I was told I'd get a biopsy within a month or two. After 3 months, I rang up and they said it was now looking like it'd be 4 months from that point, and I rang up again a few days ago and they now said she couldn't even tell me when it would be, and that they were still working their way through people from December.
Murray, Paul and Ewan, their situations aren't new. Back in 2015, Dave McLean had an enlarged prostate and developed an infection. He describes the pain as unlike anything he'd ever experienced before.
Extreme burning. It was as if the penis was immersed in boiling water.
Dave had a catheter inserted. It stayed in for months until he had surgery at a private hospital, thanks to his employer's health insurance.
And the price of surgery without Southern Cross cover is around about $10,000.
Wait a sec, the price of the surgery, why didn't you have this in the public system?
You would have to ask the public system. It would seem, when I asked my GP, if it was normal to go so long with a catheter before deciding, he said that, well, in his opinion, it would not be normal, but that's just the way the public hospital system was.
How long did you have a catheter in for?
5 months.
The damning external review of the Southern DHB's urology service identifies major flaws in the way the department is run. It says, and I quote, "There is a significant level of clinical risk within the long-waiting patients at the Dunedin site." It says some patients are 3 years overdue for a follow-up. Surveillance cystoscopy is up to 1 year overdue, while, quote, major oncology cases can wait for 6 months or longer for surgery. That's major oncology cases. The review says there's also a poor understanding of the size of the patient population being treated and the demands the department needs to meet. It identifies a rift between clinicians and senior managers. And Murray, who doesn't have private health insurance, says he's no longer prepared to wait weeks for a diagnosis.
Having decided that 12 weeks was going to be an awfully long time to wait for an initial consultation, which is all it was to be, I went back to the GP, and between us we talked it through and decided that a private consultation could be held quite soon, and indeed within a few days, within 2 days, a letter arrived from the clinic arranging an appointment, which is about 4 weeks from now.
During our coverage of the story over the past 3 weeks, the chairman of the New Zealand Urological Society, Stephen Mark, told us the waiting times were, and I quote, a crisis of patient care. Over the weekend, the DHB published an apology in the Otago Daily Times newspaper. 2 patients, it said, had been waiting too long for treatment. Urology Service Clinical Leader Alistair Hepburn, who has previously spoken to Checkpoint, has responded to the report by saying he hopes it will, and I quote, translate into a real improvement in the delivery of the urology service to our patients who, frankly, deserve better, end quote. But Murray says whatever changes may happen, the fact remains the public health system has not been up to scratch.
Time is of the essence to at least know where you stand, what the situation is, and it does seem to be failing in providing that timely information.
It's Murray, one of the patients who's been waiting for service treatment from the urology department.